Hey, let's do this, America. That's right, Dr. Mike Sevilla back. And we're going to be talking about a couple of very important topics today, Medicare, SGR, and we're also going to be talking about the AAFP virtual lobby day today, March 19, 2015. And my special guest who is joining me is AAFP President Dr. Robert Wergen. Bob, it's always great to talk to you, sir.
Thank you, Mike. I'm glad to be here. These are important times.
Now, Bob, so before we get into SGR, you were just in D.C. Talking with Congress. Can you share a little bit about what you were doing this week?
Yeah, on Tuesday of this week, I had the opportunity to testify in front of the Senate Health Committee. It's Health, Education, Labor, Pensions, Lamar Alexander, and it was on electronic health records. And the 2 points we made there and really emphasized was the meaningful use criteria, delaying the penalty phase and making it more meaningful, not in name only. The second part was interoperability, having meaningful notes to be able to share with each other clinically, not just data dumps. So we were received very favorably, and the committee all, I think, got the points we were trying to make.
Now, I know you were on C-SPAN because I DVR'd it, and a lot of people have gotten you good feedback. Have you heard feedback from your C-SPAN,
Yes,
appearance?
I had a lot of good feedback from both the government relations staff, and after the meeting, which wasn't on the C-SPAN, had a kind of a lineup of people coming up say, we enjoyed your stories, we get the points, and we're going to move forward and work harder. And it's for our members. We've got to have significant changes in meaningful use criteria, and make it meaningful, and make the electronic health record help us take care of our patients. And they got the message.
Well, thank you so much for doing that. I mean, it's I know you take a lot of time for the Academy and for family physicians, but let's kind of shift into this Medicare SGR. We've been talking about it, especially AAFP, family docs have been talking about it. But Bob, when you talk to members, when you talk to family docs about Medicare SGR, what do you tell them? Why is it so important for family docs to know about?
Well, as they all know, this is 17 times before we've had short-term patches, and this year it'll be April 1st, a 21% cut if nothing is done. And we have really pressed hard in our government relations to slay this sustainable growth rate flawed formula dragon that we've dealt with over these years, and we've got a great opportunity. There was a bill that's going to be introduced probably next week that is going to stabilize this sustainable growth rate and do away with it and move to a stable 5-year 0.5% increase for primary care, and then move into value-based care, consolidate all the reporting criteria into one. So there's a lot of good things with the bill, and the bill is structured on the bipartisan, bicameral bill that was introduced last spring. And for many of you probably saw that the patch was voted in last spring at 11:30 at night on a voice vote in front of Congress with no one there. So it was kind of, we had a good opportunity then. This is probably our best opportunity. But what I'm asking everyone to do is, today we have a virtual town hall meeting. The phone number to call is 866-629-5269. You identify yourself and where you're at, and they'll connect you. And to give your voice to say, hey, we need to slay this dragon, do away with this sustainable growth rate, to bring that stability to our practices over the coming years. And one last thing I'll say, Mike, I don't want to rattle on too long, was when we were on the Hill with Speaker Boehner's staff, they were all very supportive. They understand this. They had commented during the talk, well, last year we only had 8 letters about SGR, and we told them, well, we'll fix that. We're going to have a huge response from our membership on this one. And don't underestimate what you as a constituent can do for the Academy, and I hope we don't have to go to a 19th or 20th patch. This is our opportunity right now. It's probably never been better than right at this moment. We need to carpe diem, seize the day. This is our time to do it.
I cannot agree more with you, Bob. And you know, as family docs talk about this, as I go to leadership meetings, as I talk, I mean, as we hear from AAFP leadership, every time they go to the Hill, they're kind of inching more and more towards a permanent solution or getting rid of SGR. As you go to the Hill, have you talking with them? You know, our legislators, are they really, you know, is this the time, Bob? Is this the time that they're really going to make some kind of permanent change, do you think?
I believe it is, and you bring up a good point, Mike. When we come into the room, especially with the leadership, with Congressman Boehner, or Speaker Boehner, Nancy Pelosi, where we come in the room, the staffers often say, "Okay, we know, SGR." So we know we're getting the message across. They understand the points. They know it's time to do away with it. They recognize it's flawed. The one challenge during this current Congress is we've got a lot of new freshmen senator or congressmen and with new staffers who were familiar, but not to the degree of some of the established ones. So we need to. That's where we need to put our push. But they respond. We heard that message over and over to their constituency. So they said, well, we got 8 letters, 10 letters. So I would, again, participate in the virtual town hall meeting, but also go to Speak Out. There's a link with the email sent out, and send the letter along with it. And they tabulate that, and it'll be important to do that. I truthfully think we can do it before the end of March here. Congress has a recess beginning March 26th. If they pass it, it'll go to the Senate, and then it'll be another push at that arm. But I truly believe the congressmen we interact with and we've been interacting with, they get it. They know it's a flawed formula. They want to do it. The pay-fors last year were a holdup, but they've addressed that in this bill. So I think this is our best opportunity. If not now, when? We'll get into presidential politics if we go too far in the summer, and we may have to wait more than a year or a couple years to get into where we can readdress this meaningfully again.
Before I let you go, Bob, one of the fun things you get to do is to visit chapters and to see you know, what they're doing these days. Can you share with the audience where you're at and what you'll be doing here this
Sure.
weekend?
Well, that's a wonderful part of my job, to reach out, meet all of you in your settings, and find out what the issues are by being there. But I'm currently in my home state in Nebraska, and I have the honor tomorrow night to install one of my best friends from Lexington, Nebraska, Joe Miller, as president of the Nebraska chapter of the American Academy of Family Physicians. So it's a thrilling time, and I'm gonna, after I finish here, I get a main stage. They let me sneak in for 5 minutes, and I'm gonna give them the same message I'm giving you now, Mike. Is get on that town hall today, go to Speak Out, send a letter. This is our time. We think it can happen, but we need your help. We need your voice.
And that phone number again is 866-629-5269 for today, Thursday, March 19, 2015, from 9 a.m. to 6 p.m. Eastern Daylight Time. Also going to Speak Out. Bob, it is always great to talk to you. I'm looking forward to seeing you in person again. But this is you're going out of your comfort zone here, Bob. I really appreciate it.
Yeah, I'm getting real social media techie here, Mike.
Thank you, everybody, for joining us, and there'll be more updates very soon. Anything else to close up with, Bob?
I just want to thank you all for your membership and your engagement in the Academy. That's the most important thing in my travels and all that. It only makes me feel better as a family physician that we're on the right side of these arguments in healthcare in America. Thank you for being members, and we're going to work hard on bringing value to your membership as well. This is an important point. Don't put it off. Do it today.
You get more information at aafp.org. I'm, of course, Dr. Mike Sevilla, drmikesevilla.com. Follow me on Twitter and Facebook as well. So thank you, everybody, for your time, and have a great day.
Thank you, Mike.